talking about the utility of PCSK9 inhibition. It's a new class of drugs, a new principle to lower LDL quite dramatically. The study that we are looking at is called SPIRE. It is looking at the utility of Bococizumab, a humanized antibody that is lowering LDL levels by injections given every second week. The trial enrolled over 27,000 patients. Now, as a background, it is important to know that from phase 1 and 2 studies of Bococizumab, there was seen indeed a quite dramatic decrease of LDL, but an attenuation over time of this effect. The results showed that there was highly efficient reduction of LDL as expected, particularly initially after randomization to placebo or to the active injection. However, over time, one again in this phase 3 trial program saw an attenuation of the effect. Now, when it came to the primary endpoint of cardiovascular events, the phase 3 study indeed conferred a reduction of cardiovascular events in that part of population that was followed over 2 years, but there was a problem. It was an immunogenic reaction based on the principle of giving a so-called humanized antibody. And the problem manifested itself in injection site reactions, which were seen in almost 10% of all patients. Unfortunately, that was leading to the discontinuation of this developmental program by the sponsor. So the entire field of PCSK9 inhibition is fortunately not hampered by this finding, because we have seen that in a different trial, actually presented today, the utility of another antibody has produced rock-solid reduction of LDL over time. Hence, the conclusion is that the immunogenicity is an aspect that has played a role in this trial, but fortunately, this field is still open for excellent innovation in reductions of risk factors and cholesterol.